All right. So the common misconceptions versus reality, why this conversation is so important. Like I just mentioned, VWD is often associated with nosebleeds, heavy menstrual bleeding, bruising, surgical bleeding. But joint health is an important part of that conversation too. One misconception is that joint health damage only happens in hemophilia or severe VWD, but we know that's not necessarily the case. But people with VWD can also experience joint bleeding, long-term complications. So when symptoms are missed or minimized, diagnosis and treatment can be delayed. So early recognition matters because timely recognition and treatment may help protect long-term joint function. So if we can get ahead of it and protect our joints, that's the goal. And so no matter the type of VWD, joint symptoms deserve attention, especially when there's pain, there's swelling, or there's changes in somebody's mobility. That deserves recognition. All right, so the first misconception, number one, VWD is a mild bleeding disorder. How many of y'all, does that just hit a button for some of y'all? Does that just make you just want to, your blood boil a little bit when you hear that? So that is one of the biggest misconceptions, that VWD is usually mild. While some people with VWD may have some mild symptoms, VWD exists on a clinical spectrum, meaning symptoms can look very different from one person to the next. Even within our own families, I know my husband's bleeding looks completely different than our daughter's bleeding. So severity is not based on diagnosis by name, like whether you're a 2, A, B, M, or N, or type 3. It really depends on your factor levels, your von Willebrand factor activity, your factor 8 levels, your bleeding history, your bleeding patterns, and even your phenotype. So for some people with VWD, it can lead to serious bleeding complications, joint bleeding, long-term joint damage. This is why it's important not to assume that VWD is harmless and it's no big deal. Just because it is often described as mild, when we label VWD as mild, patients may not be taken seriously, and symptoms like joint pain and swelling or stiffness or limited movement may be overlooked or even dismissed. So the key point is mild does not mean no risk. Even a small amount of blood in a joint can be very irritating and very damaging over time. All right, so before we go into more of the misconceptions and things like that, and the complications, it's important to understand what is happening when a joint bleed occurs. So you can see the little graph on here. We have a healthy knee joint, and we have a joint bleeding into a knee joint, and of course, damage of a knee joint over time. So when blood enters the joint space, as blood enters the joint space, the body reacts and it starts to break down that blood. And as the blood is broken down, iron gets released. And when iron gets released, it is super, super irritating and damaging to the joints. It's basically corrosive to the joint. It can cause swelling, warmth, pain, stiffness, and decreased range of motion. A person may also notice that they might start limping a little bit more, difficulty bearing weight, or feeling like the joint is tight or maybe even full. So the concern is that blood is irritating the joint lining and cartilage. The lining can become inflamed and thickened, and over time, when that happens, it can grow extra tiny blood vessels, and those vessels can become fragile and making that joint more likely to bleed. So which creates this bleed, more fragile joint lining, more bleeding. So if bleeds are missed or they're untreated or happen repeatedly, it can lead to chronic inflammation and gradual breakdown of the joint. And over time, this causes arthropathy, which is joint damage similar to arthritis, but that's when you hear arthropathy, that's related to bleeding disorders. So the key message is that a joint bleed is not just temporary. It can become a long-term joint health issue if it's not recognized and treated early. All right, misconception number 2. VWD rarely causes joint bleeds. Joint bleeds are only seen in type 3. Not the case. So there was some research from the Netherlands on VWD that showed 34% of people with VWD already have long-term joint damage, and 71% of those with joint damage live with chronic pain. It has been reported in one study in the age group between 18 and 30, 50% of type 1 and 41% of type 2 patients report joint problems. And sadly, most patients have to bleed their way to treatment because prophylaxis isn't offered early enough. So the challenge is that joint bleeding and VWD may be unrecognized, underreported, which I think is really big. So if a person with VWD has joint pain, swelling, stiffness, or warmth, limited movement, it may be labeled as an orthopedic issue, an injury or arthritis or inflammation without ever considering bleeding as a possible underlying cause. And so tonight, you'll also hear from Stephen, who has VWD, who has experienced the majority of his adult life with these issues before actually being diagnosed. All right, so wow. That's a good bit of y'all that have had 5 or more bleeds. Wow. More than one is way too many. Wow. Dang. All right. Well, thank y'all for sharing that. All right. So treating a joint bleed. So what do we do when we get one? When a joint bleed is suspected, early recognition matters. So I'm sure many of you have heard the rest, ice, compression, elevation can help support the joint. They actually have a new acronym too. It's called PRICE, which basically just adds the P to it, which adds the protection. You want to adds the protection of the joint from further stress. But in VWD, supportive care may not be enough. Patients may need factor replacement or another medication based on the hematologist's plan. Also, it's very important for tracking symptoms, and your bleeding frequency can help identify patterns, whether you're using it on an app or you're documenting it on your phone. So if bleeds are frequent and severe or happening very repeatedly, it's important to talk with your hematologist about whether prophylaxis may be needed. I know many of you selected 5 or more. I hope you've had a conversation with your hematologist about those bleeds to talk to them about whether prophylaxis may be something of benefit to you. All right, misconception number 3. Only type 3 are at risk for joint damage. No, not so much. So another important misconception is that type 3 VWD patients are at risk for joint damage. Now, type 3 does carry the highest statistical risk because these patients often have very low or absent von Willebrand factor, and they also may have very low factor VIII levels, but subtype alone does not tell the whole story. A person's actual bleeding pattern, their factor levels, history of trauma, any kind of injuries, or delayed treatment, repeated bleeding episodes all matter. Joint damage is driven by blood exposure inside the joint. So the tissue is not just the label of type 1, type 2, or type 3. The issue is whether blood is getting into the joint space and how quickly it's recognized and treated. So even small repeated bleeds, sometimes called micro bleeding, may contribute to inflammation over time. So if these bleeds are missed or treatment is delayed, like I said earlier, that joint lining and cartilage can become irritated and damaged and leading to that arthropathy. So the key message is type 3 patients are at the highest risk, but they aren't the only patients who deserve joint health awareness. Any patient with VWD who has joint pain, swelling, stiffness, warmth, or changes should be evaluated with their bleeding disorder in mind. So you're going to hear a lot of that repetition, but it's because we're trying to drive it home. All right. So misconception number 4. If imaging is normal, there is no joint damage. No, not necessarily. So MRI is the gold standard for assessing joints and bleeding disorders because of its superior ability to detect early changes and soft tissue changes. Also can see that synovial thickening and also can see the cartilage damage. Another option for imaging is a musculoskeletal ultrasound. It's often used as a faster, more accessible, and cost-effective alternative for monitoring. Many HTCs offer this, and I'm sure Ken will be able to talk about that a little bit more. An ultrasound can check for bleeds and also can view the inflammation around a joint. Also, I do want to note, if someone does show on an X-ray, if you can actually see it on an X-ray, that already shows you that long-term damage has been done. All right. Misconception number 5, joint pain isn't related to VWD. We actually had a doctor say that to us, which is crazy. That's not true. So another misconception is that joint pain is not related to VWD. Many people think of VWD, like I've said, causing other kind of bleeding, but joint symptoms can also matter, especially when there's a history of bleeding or unrecognized joint bleeds. And this is another thing. Not every joint bleed presents dramatically. Somebody's bleed might not be this big giant swollen knee or this big giant swollen elbow. It may be more subtle, especially early on. Our person may not always have obvious swelling right away. Instead, they may notice warmth in the joint, tingling, stiffness, pain, or feeling that the joint does not move normally. And sometimes that pain is just indescribable. It may be a pain that it's hard for you to describe. Also, reduced range of motion can be an important clue. And sometimes patients begin avoiding certain movements without even maybe realizing it. For example, they may stop bending the knee fully. They may avoid the stairs. They may start limping a little bit more or favoring the other leg or arm, or protect the joint because it feels uncomfortable. So swelling and pain are also common warning signs, but the key point is that symptoms can vary. So if a person with VWE has a new or worsening joint pain, especially with warmth, swelling, or stiffness or decreased movement, it shouldn't be dismissed and it definitely needs to be recognized. It's also important to recognize that women are often under-recognized in bleeding disorders just in general. So their symptoms may be attributed to hormones, overuse from sports or injuries, or general joint problems instead of considering whether a bleeding disorder can be involved. So the key takeaway is joint pain and VWD deserves attention. It doesn't always mean a bleed, but it should be evaluated through the lens of that person's bleeding history. So another misconception is that one or two bleeds or infrequent joint bleeds won't cause long-term damage. All it takes is one joint bleed to really, anytime there's blood outside of anywhere in the body where it's not supposed to be, it can cause damage. So those infrequent joint bleeds, another misconception is that infrequent joint bleeds will not cause long-term damage. The reality is that even an occasional bleeding into a joint can trigger inflammation, especially when that iron gets to release and it sits in there, it can just wreak havoc. So when blood enters the joint, the body has to break it down. And the iron got tongue-tied for a second, deposited into that joint lining. It can be very irritating and lead to chronic synoviitis, which means the joint lining becomes inflamed and just more fragile. And over time, this inflammation can begin to damage that cartilage and that smooth cushion of the cartilage of the joints that helps the joints move easily. Once that starts to break down, that joint may become painful, swollen, and harder to move. And over time, it might end up with bone on bone. So the important point is that risk is cumulative, meaning everything adds up. So the more exposure of blood into the joint, the more it's going to cause damage. So it's not just always one major bleed that causes the damage, it's the recurrent smaller bleeds that add up over time to create that accumulative effect. So when we talk about joint bleeds, we want to think of beyond just the immediate pain. We also want to think about protecting the joint long-term by recognizing symptoms early, treating appropriately, and of course, tracking your patterns over time. All right, so this is just the pathophysiology of long-term joint damage. Sorry, I'm getting tongue-tied. You have the bleed, then the iron, your body starts to break it down. You have the iron deposition, which can create this synovial inflammation, which can over time make your cartilage wear away, which leads to arthropathy and of course chronic pain and functional limitations. So like we've been saying, even infrequent joint bleeds can matter. When blood gets into that joint, it can trigger that inflammation and irritate the joint and damage it over time, damage that cartilage over time, which can contribute to the arthritis-like joint changes, and the repeated bleeds can add up. That's why early recognition and treatment are important, even if the bleeds don't happen that often. All right, so what are the long-term complications of joint damage? So long-term damage can lead to chronic inflammation, reduced movement, muscle weakness, chronic pain, early arthritis-like changes, arthrofibrosis, and functional impairment. Arthrofibrosis can happen when repeated bleeding and inflammation can trigger scar tissue buildup inside the joint, making the joint very stiff and hard to move. It can almost be like cement inside the joint. These complications can affect daily life, mobility, work, school, your quality of life. In severe cases, orthopedic treatment or joint replacement may eventually be needed. This is why joint bleeds should be recognized and treated early. The goal is to protect the joint long-term and not just the immediate pain. All right, so treating the joint damage, of course, you want to collaborate with your local HTCs. It requires a team approach. Your HTC can help coordinate with hematology, physical therapy, and orthopedics. Physical therapy may help improve your strength, your balance, your flexibility, safe movement, while tools like KT tape or even braces may help provide that extra support. In more severe cases, surgery may be considered, including a joint replacement. Some people might have to have a joint fusion, depending on where the joint is. A synoviectomy, which removes the inflamed joint lining that may contribute to pain or recurrent bleeding. The goal is to protect the joint and to reduce the pain, preserve function as much as possible, and just to really improve your quality of life.